What if the people you trusted most, your doctor, your government, watched you die and called it science? In 1932, hundreds of black men in Alabama signed up for what they thought was free medical care. Instead, they became unwitting subjects in one of the longest and most horrifying medical experiments in American history. This wasn't a secret project run by some underground lab. This was approved, government-funded, and carried out by public health officials for 40 years. They called it a study, but the men didn't know they were being studied. They didn't know they had syphilis, and even when a cure was discovered, they were never told. This is the story of the Tuskegee Syphilis Experiment, a dark history of silence, betrayal, and the price of blind trust. To understand how this could happen and why it still matters, we need to go back to 1930s Alabama. The year was 1932. America was deep in the Great Depression. In the rural South, poverty wasn't just common, it was expected, especially if you were black. Tuskegee, Alabama was a small town, surrounded by red dirt, cotton fields, and a legacy of slavery that never really went away. Most black families worked the land, scraping by on what they could grow or barter. Access to health care? Almost non-existent. Hospitals didn't serve black patients unless absolutely necessary. Many black families couldn't afford doctors anyway, and when they did go, they had to trust that whatever treatment they were given was right. Questioning a white doctor in the Jim Crow South, that simply wasn't done. And that trust, quiet, vulnerable, and generational, is what made the Tuskegee study possible. At the time, syphilis was a major public health concern. It affected hundreds of thousands of Americans. It could take years to destroy the body, slowly attacking the heart, the brain, the nerves, until the person went blind, mad, or died. The Public Health Service, a branch of the U.S. government, wanted to study the natural progression of untreated syphilis. In theory, that sounds clinical, but in practice, it was anything but. They chose 600 black men in Macon County. 399 had syphilis, 201 did not. None of them were told the truth. Instead, they were told they had bad blood, a vague, Southern term that could mean anything from anemia to fatigue. They were offered free checkups, meals, and burial insurance. For men living in poverty, this was more than enough to say yes. The government promised to treat them. But the truth was, the goal wasn't to heal. It was to watch what happened as the disease ran its course. No medicine, no intervention, just quiet observation. At first, the plan was to study the men for 6 months, but 6 months turned into a year, then 5, then decades. And even when penicillin became widely available in the 1940s, a proven cure for syphilis, the doctors didn't offer it. Not because they forgot, but because the experiment needed to continue. What followed wasn't science, it was betrayal, carried out in exam rooms and paper charts, and for 40 years it stayed hidden. They were promised help, free medical care, a government-backed health program. For many of the 600 black men who joined the Tuskegee study in 1932, it sounded like a blessing, especially in the Deep South during the Great Depression. No one told them they were signing up to be watched, not healed, that they'd be denied a cure even when one was found, that their suffering would be measured, documented, and ignored, and that they'd be part of one of the longest and most devastating medical betrayals in American history. The study was officially called the Tuskegee Study of Untreated Syphilis in the Negro Male. It was conducted by the U.S. Public Health Service, a federal agency, and it wasn't some rogue operation. It was well-staffed, well-funded, and approved at the highest levels. The plan: recruit black men in Macon County, Alabama, 399 with syphilis and 201 without. Observe the long-term effects of untreated syphilis on the human body, not just physically but neurologically, emotionally. The only condition: no treatment, not ever. But no one told the men that. Instead, the government used vague, familiar language. They told the men they had bad blood, a local catch-all term used to describe everything from fatigue to infection. No one used the word syphilis. No one said it could kill them. In exchange for their participation, the men were offered simple things: free checkups, bus fare, hot meals, and eventually, burial insurance. For men living in poverty who had never seen a doctor before, it felt like a miracle. It felt like someone finally cared. But what they didn't know was that their care was never the point. As the years passed, the men continued coming to the clinic. They trusted the doctors. Some of them even built relationships with the nurses, especially one named Nurse Eunice Rivers, a black nurse from the area who became the face of the program. Many participants believed she was their advocate. In reality, she helped keep them in the study. That dual role, comforter and deceiver, still haunts public health ethics to this day. The men began to show symptoms: rash, lesions, blindness, cognitive decline. But they were never given medicine, only placebos, vitamins, aspirin, tonics, things that made them feel treated but didn't slow the disease. Then came 1947. That year, penicillin was widely accepted as the standard treatment for syphilis. It was cheap, effective, and life-saving. The world changed, but not for the men in Tuskegee. The doctors made a choice to withhold the cure, on purpose, because giving them penicillin would ruin the integrity of the study. They even took steps to make sure the men wouldn't accidentally receive treatment elsewhere. Letters were sent to local health departments, warning them not to treat participants who might show up seeking help. The men's names were flagged, tracked. They were not just denied care, they were prevented from finding it. Some of the men died, others suffered in silence. Their wives, unknowingly infected, passed the disease to their children who were born with congenital syphilis. Generational harm, compounded by lies. In 1966, 34 years into the study, a public health service employee named Peter Buxton raised concerns internally. He asked why the men weren't being treated, why the study was still ongoing, why no one was stopping it. He was ignored. 2 years later, he wrote again. This time, his concern was forwarded to senior officials. The response? They said the study should continue until completion. But what did completion mean? Death? Madness? The last autopsy? In 1972, frustrated and horrified, Buxton leaked the story to the press. The Washington Star published the first article. The New York Times followed. Headlines screamed across the country: syphilis victims in U.S. toward. Study went untreated for 40 years. The public reaction was explosive. There was outrage, disbelief, shame. Congress held hearings, lawsuits were filed. The study was officially shut down that same year, after 40 years of deception. But by then, the damage was irreversible. At least 128 men had died directly from syphilis or related complications. Dozens of their wives had been infected. At least 19 children were born with the disease. And all of it, could have been prevented. A class action lawsuit was filed in 1973, and the government settled out of court for $10 million. Surviving participants and their families received lifetime medical care, a hollow gesture to those who had already lost everything. For years, the government refused to apologize. It wasn't until 1997, 25 years after the study ended, that President Bill Clinton formally acknowledged the tragedy. He invited the remaining survivors and their families to the White House and issued a public apology. The United States government did something that was wrong, deeply, profoundly, morally wrong. It is not only in remembering that shameful past that we can make amends, but in remembering that past, we can build a better present and a better future. But the apology didn't erase the pain. It didn't bring back the dead, and it didn't fix the thing that was truly broken: trust. Because this wasn't a mistake. It wasn't a miscommunication. It was a decision made again and again for 4 decades. A decision to treat human lives as data points, a decision to place scientific curiosity above basic humanity. And for many in the Black community, it became a defining symbol of why not to trust the system. To this day, the Tuskegee effect is cited by health professionals as a key reason why many African Americans are hesitant to engage with the medical system, especially with vaccines, clinical trials, and public health initiatives. And can you blame them? When your history includes 40 years of being used as an experiment, without your consent, how long does it take to trust again? What happened in Tuskegee wasn't ancient history. The last surviving participant died in 2004. The youngest child born with syphilis because of the study is still alive today. And the echoes of that betrayal in hospitals, clinics, conversations continue. Not because people want to dwell in the past, but because they still live in its shadow. So what happens when a nation's most trusted institutions break that trust and bury it for 40 years? What did we learn, and what are we still unlearning? The Tuskegee study didn't just destroy the lives of 600 men and their families. It broke something far bigger, something much harder to measure: trust. For many African Americans, this wasn't just a betrayal. It was proof of what they had long suspected, that the healthcare system wasn't built for them, that their lives, their bodies were seen as less valuable, that even the government could not be trusted to protect them. And that legacy has endured. To this day, public health officials refer to the Tuskegee effect, a widespread mistrust of medical institutions within the Black community. It plays out in hesitancy toward vaccines, reluctance to participate in clinical trials, and fear around doctors and hospitals. During the COVID-19 pandemic, this legacy became painfully visible. While misinformation spread across all demographics, Black Americans were especially hesitant, not because they didn't understand science, but because history had taught them to be cautious, and Tuskegee is just one reason why. On a systemic level, the study forced a reckoning in medical ethics. In 1979, the U.S. issued the Belmont Report, outlining the core principles for research involving human subjects: respect for persons, beneficence, justice. Institutional review boards, IRBs, were established to review all research involving human participants. Informed consent became a legal and ethical standard. Medical experimentation would never again be allowed to operate in silence, at least in theory. But the lesson here isn't just about rules and policies. It's about human dignity and how quickly it can be taken when systems prioritize curiosity, data, or profit over people. Tuskegee reminds us that evil doesn't always wear a lab coat soaked in blood. Sometimes it wears a white coat, speaks gently, and promises to help while doing nothing at all. And after 4 decades of silence, the apology finally came. But what does an apology mean when the people who most needed to hear it are no longer here? In 1997, 25 years after the study ended, President Bill Clinton finally apologized to the survivors and their families. But the truth is, most of the men never heard that apology. They were already gone. And even today, that silence still echoes, not just in medical records or history books, but in conversations between families, in the quiet doubt before a hospital visit, in the pause before a vaccine. The Tuskegee study isn't just a dark chapter. It's a mirror, showing us what happens when power goes unchecked and when human beings become invisible in the name of research. If this story moved you or made you reflect, share it. These voices were silenced once. Let's not let them be forgotten again. Thanks for listening to Dark History. Stay curious, stay human, and never accept silence where there should be truth.